Most of us don't think about our spine until it actually starts hurting. But when we do, it is already late. So, in this conversation, we'll be speaking a lot about our spine in a very simple, in a very efficient, and honest way. So, for these conversations, we have with us Dr. Sagar Khairnar, who is an orthopedic spine surgeon from the last 3 to 4 years. We'll be speaking about our spine problems, our spine health in general, and some small problems that if we fix, we can fix a long issue. So, let's begin. Thank you, Dr. Saga, for being here.
Pleasure being here.
Let's begin. Thank you.
So my first question to you, sir, is why you chose online medium to speak about spine health and spreading awareness. What was your motive behind it?
So, being a spine surgeon, most of the patients don't understand how to take care of their spine on a day-to-day basis. So, social media is a good platform for giving information about tips and tricks on a daily basis and to create awareness about spine health. That is the main reason.
Great. So, doctor, we hear about these common terms such as vertebrae, disc, and spinal cord. But could you tell us in very simple terms what exactly is a spine and what does it consist of?
So, spine is basically made of 5 regions called cervical, thoracic, lumbar, sacrum, and coccyx, made of 33 bones. Each bone is called vertebra, and between the two vertebral bones there is disc. This disc is made up of water as well as jelly, which absorbs the pressure whenever you are doing some heavy activities. So this disc protects the spinal cord. Spinal cord goes through the vertebral bones. There is a gap, and through which the spinal cord goes, and from the spinal cord emerges all the nerves. The nerves in the upper area supplies the hand, and nerves in the lower area supplies the legs.
Great. So, what are the biggest myths that you have heard from your patients? You have professionally done spine surgeries from the last 3 to 4 years. What are the biggest myths that people come to you with?
So most common myth is like एक बार जो पेन हो गया, बैक पेन, वो हमेशा रहता है, या अगर स्पाइन की अगर कोई नस दब गई है तो वो कभी फ्री होती नहीं है. और उससे भी ज़्यादा एक मिथ है कि स्पाइन सर्जरी बहुत ही जानलेवा है. These are like 3 biggest myth or misconceptions in day-to-day practice.
Okay. आजकल की दौड़ भाग वाली जिंदगी में बैक पेन has become very common. So back pain has become a daily lifestyle habit for everyone, and people do normalize it. What do you have to say about this?
So if you look back in maybe in 90s or like in early 2000s, people were physically more active. There was no like work from home, or like the lifestyle was not that much sedentary. Nowadays it's more of like work from home, sedentary lifestyle, lack of physical activity. So all these things, they are weakening your core muscles. Like the spine core is getting weaker, bones are getting weaker, and that's why they are having more of like mechanical back pain. So this pain, because of poor constitutory structure, is damaging their bones as well as muscles. That is a result of like posture problems, and like hunchback is more common in females.
Okay. Spine MRIs, speaking of spine MRIs, they are very expensive today, and there are different types of spine MRIs. But when you suggest spine MRI to any person or your patient, what is their first reaction? Do they go for it, or are they really scared?
No doubt MRI is very expensive, but MRI is not needed in all conditions. See, there are like certain conditions, like if the pain is persisting for like more than 1 month or so, if pain is associated with any tingling or numbness, like what we say in simple language, झंझनाहट, or if there are conditions like neurological involvement, मतलब हाथों की movements नहीं हो रही है, पैरों की movement नहीं हो रही है, चलने फिरने में दिक्कत आ रही है, in those conditions MRI is very much essential. So I don't advise MRI in the first setting or like second setting.
Since we have spoken about MRIs, there are 2 different types of MRIs. One is 1.5 Tesla and 3 Tesla. What do you think? Why do people prefer 3 Tesla over 1.5, or do they generally have any preference as such?
Is more of like a technical thing. So there is nothing more specification as such, but definitely, so 3 Tesla gives a finer detail, gives a like much more clearer picture as compared to 1.5 Tesla. But the main thing is like to do MRI first. So whether it is 1.5 Tesla or 3 Tesla doesn't matter. More important is to do a MRI scan. If you can afford and if it's actually possible, 3 Tesla is always better.
Okay. So as we spoke about how people have normalized their back pain and everything, what do you think that people tend to avoid their small spinal problems and back pains, and then maybe it might lead to them being in a situation where spine surgery is the only solution. So why do people keep delaying it?
So your question is like what I see on a day-to-day basis. So most of the patients, they don't come immediately if they have back pain. If they take some time, they do some home remedies, they do some simple measures like taking pain medications or doing some rest. But when the pain increases to an extent, like maybe after like 2 to 3 weeks, in spite of doing all those home remedial measures, pain is still persistent. That time they seek for consultation. So in those duration, it doesn't make that much difference if for delaying the treatment. But if there are certain patients who are coming very late, they are coming directly with some like neurological problem, like उनका पैर के movements नहीं होते हैं, चलने में दिक्कत आती है. For those conditions then those diagnosis and the treatment initiation वो उसमें time जाता है, and then recoveries will take even much more time. So that is not a good thing. So that is not a good sign for recovery.
Okay, but let's imagine there are two conditions here. One is a small acute spinal pain, back pain, which is persisting for 1 or 2 days. Now, how to identify if it is a severe back pain or if it is not dangerous?
So, a pain lasting for 1 to 2 days and it's a very recent onset, just अभी चालू हुआ है, and specifically जब भी अगर आपका कुछ exertional activity ज़्यादा हुआ है तो वो पेन इतना सीरियस most of the times नहीं होगा. So with simple measures like through rest, with over the counter medications like paracetamol and all, वो उससे पेन कम हो जाएगा. हाँ, बट अगर पेन persistent हो रहा है after 10-15 days also, and if the intensity of pain is increasing and if the pain is associated with other signs like पैरों में झुंझुनाहट हो रही है या फिर अपना पेशाब करने में तकलीफ हो रही है, then those back pain requires consultation.
Okay, so speaking of consultation, we have heard from spine doctors speaking about red flags. So according to you as a spine surgeon, what are those red flags कि ये आपने नोटिस कर लिया तो उसके बाद आपको इमीडिएटली कंसल्टेशन की ज़रूरत पड़ती है?
पेन की इंटेंसिटी बढ़ रही है दिन ब दिन, या फिर अगर वो झुंझुनाहट के साथ बढ़ रही है, या फिर उनको पेशाब करने में दिक्कत आ रही है, या फिर फीवर आ रहा है, तो ये ऐसा ही कि ये रेड फ्लैग साइंस हैं.
बहुत सारे लोग सर्जरीज के लिए आज भी डरते हैं. They might come to you and say कि डॉक्टर प्लीज सर्जरी मत बोलना बस. So what do you think?
उनकी जो ये सोच है कि सर्जरी नहीं करना है, ये बहुत लाजमी है. बिकॉज बहुत सालों से क्या हो रहा है कि लोगों के मन में एक अंधविश्वास की तरह बैठ गया है कि स्पाइन सर्जरी ये एक जानलेवा है. तो क्या होता है कि पहले के ज़माने में स्पाइन सर्जरी और क्या स्पाइन एक्सपोजर इतने नहीं थे. अभी विद एडवांस ट्रीटमेंट्स हो रहे हैं, एडवांस टेक्नोलॉजीज आ रही है, और जो फाइनर इक्विपमेंट्स हैं उसके बदौलत जो स्पाइन सर्जरी भी बहुत इजीली हो जाती है.
ओके, स्पीकिंग ऑफ द अंधविश्वास,
अर्लियर टाइम्स में पुराने ज़माने में स्पाइन सर्जरीज बहुत अलग तरीके से हुआ करती थी, और अभी आफ्टर द एडवेंट ऑफ मॉडर्न टेक्नोलॉजीज एंड एवरीथिंग देयर इज अ वास्ट डिफरेंस बिटवीन स्पाइन सर्जरी नाउ. व्हाट डू यू थिंक कि ये डिफरेंस इन अ गुड वे लेके जा रहा है हमें या नहीं? It starts basically from spine training program. There has been increasing fellowship spine programs, and there are finer equipments meant for minimally invasive spine surgeries, better technologies. Most of the spine surgeries are done under microscopes or like finer loops. So all this practice together improves quality of spine surgery.